Weather is warming, and that means dangerous ticks are targeting you and your pet. Before you head outside, we have some important information about how to protect yourself and your pets from the effects of Lyme disease. Joining us live this morning is Dr. Natalie Marks, a Chicago veterinarian, and Dr. Patricia Delamora, a pediatric infectious disease specialist in New York City. Welcome to you both.
How are you, Lindee?
Good morning, Lindee.
So, Dr. Marks, we hear a lot about Lyme disease in humans. How does this also affect our pets?
Well, you know, we see it in pets just like we do in people. I practice downtown Chicago, and you would think in a concrete jungle I wouldn't see any tick disease, but it's actually quite prevalent. I diagnose Lyme disease frequently, as well as some of the other tick diseases in dogs, just like Poppy here.
Mm-hmm. And Dr. Delamora, you're a pediatrician that's sitting with a veterinarian. Can your two types of patients really help each other to avoid Lyme disease?
Absolutely, Lindee. Dogs and kids go together like peanut butter and jelly. So if your dog's been rolling around in the grass, there's an excellent chance that your child's been rolling around in that same hill of grass. So if your child's been diagnosed with Lyme disease, you may want to let your veterinarian know that the exposure has happened. And if your dog's been diagnosed with Lyme disease, you may want to let your pediatrician know that your child may have been exposed as well.
And Dr. Marks, I'm sure this has happened to you at some point where you've had one of your canine patients that have had Lyme disease, and it turns out that the owner does as well.
It has, actually. I recently diagnosed a dog with Lyme disease, and after talking to his mom about the education behind the disease, the treatment, and where he could have acquired the disease, we found that he and his mom are going in the same environmental at-risk areas. They're hiking, they're camping, they're walking along the lakefront. I encouraged her to talk to her physician, and she was diagnosed with Lyme disease. So I think that's a perfect illustration of why the Stop Lyme campaign is really essential to creating awareness.
Yes, I have small kids, and we've had a small dog, and I honestly, and we live in a rural area, have not thought too much about Lyme disease or the ticks. I just kind of pick them off and don't worry too much about them. But I'm sure you have some suggestions that I really should be doing to protect myself and my kids from Lyme disease. What are those?
That's right, Lindee. I have a dog and small children as well, and live in a very endemic area where there's lots of Lyme disease. So when I talk to parents about checking their children for ticks, I tell them to, not miss the common areas such as the area covered by skin, the hairline, behind the ears, in the ears, area covered by underwear. That's the place you really want to look for ticks. It's different for dogs, though.
Mm-hmm. Yeah, so in dogs, Lindee, remember, there are some of the similar areas that you'll be looking for, but dogs like Poppy that have a very long hair coat, you really have to be parting the hair and looking on the skin and really checking inside the ears and under the tail and on the feet, because they're easy to miss. The very important thing to remember, too, is that ticks really start out the size of a poppy seed, and as they brush onto a patient, whether it's a dog or a human, and attach and engorge, they really only get to the size of an apple seed. So for our canine patients, again, parting the hairs, and remember the scale, just how small those ticks are, because they're easy to miss.
Yes, those are definitely easy to miss, and unfortunately with my dog, I haven't been able to find them until they are large. But when it comes to my kids, and this is our last question because we're running out of time, how do you suggest removing the ticks? I feel like that's one thing I struggle with my kids is they're uncomfortable to touch, for one thing, and I want to make sure I effectively pull it off.
Sure. So as you know, Virginia has a ton of Lyme disease. It counts for 4% of all the cases of Lyme disease in the United States. So I'm sure that your viewers are definitely asking the same question. So you really want to get a pointy nose tweezer, not a flat nose tweezer. Get as close to the skin as you can and pull straight out. You don't want to squeeze the head of the tick too much, because you can actually squeeze bacteria into the body. If you leave any parts of the tick behind, or it breaks apart, or you can't really get it out, you may want to take a trip to your veterinarian or your pediatrician or your internist to have them help you remove the entire tick.
Well, I appreciate you guys taking the time to talk with me today. These are important ticks, see? Important tips on how to remove these ticks. So where can people go for more information?
Yeah, exactly, Lindee. At stoplyme.com, Lyme, you can read more about what we've discussed here today, as well as a lot of other tips on how to keep all members of your family healthy this year, just like our best friends, Poppy.
All right, thank you guys so much for talking with me today.
Thank you.
Thanks, Lindee.